This is Pan-African Student Voice. We are Africans. We owe our being to the hills and the valleys, the mountains and the plains, the rivers, the deserts, the trees, the flowers, and the ever-changing season that define the face of our native land. Africa must revert to what it was before it was divided.
Pan-Africanism was the attempt to create a sense of brotherhood and collaboration among African descent, whether they lived inside or outside of Africa. At PASV, we promote MELTS, which is mathematics, engineering, literacy, technology and science, which is what Africa needs to invest in to be great again.
Cuba had most of its hospitals in the main city of Havana. After the revolution, they started to build hospitals all over the island, and increase that number to the extent where people in rural parts of Cuba also had access to doctors and nurses. And in all of that, in building that infrastructure, they were able to then implement a learning model where people learn within the community that they are studying medicine in. They learn within the community that they're growing up in, so that they don't have to travel from where they're from to the capital city in order to learn medicine. They could stay in whatever region of the country they were from and learn medicine amongst their own people, understand that each different part of the country has its particular problems, and cater the health that they are able to give according to the needs of that population. So the healthcare model is one that is preventative. It's one that also emphasizes collaboration between different sectors, so that people don't think that doctors are just working by themselves or nurses are just working by themselves. Doctors and nurses have to work with the teachers. They have to work with the bus drivers. They have to work with, the city officials, all these people who essentially have to make sure that the work is fluid enough that different elements of life are easy for the population, and that is what ensures health and wellness for all.
And thank you very much, Dr. Addrey. We want to ask you again. We know for sure, most importantly, during our schools and every walk of life we find ourselves, there is no science, not an easy sailing. We want you to share with us some of the challenges you face in Cuba and opportunities also.
Sure. So one of the unique things about Cuba is that I think for most of the students who end up going to Cuba to study, most people just come to the island either knowing where it is geographically and saying, oh, this is an island that is close to the United States. And then when we get there, the reality hits us that number one, Cuba is very different. Even though it's so close to the United States, it's a country that is different because of its long-standing contentious relation with the United States government. So because of that history of the United States government not wanting the Cuban government as it stands now to be the way it is, there have been serious challenges that the island has had to go through. So what we went through, what we encountered when we got to Cuba is, number one, we got exposed to what it is to be in a country that is under sanctions. This was new information for a lot of us because maybe we've heard or read about it in the news, but to live in a situation where your everyday life is impacted by sanctions is something that I think a lot of us had never experienced before. And so we realized that we were in Cuba, and these sanctions that the United States had placed on Cuba were affecting everyday life. But more so than anything, we realized that, for example, things that we may have taken for granted, such as communication and access to internet and resources for research or studying in medical school, were not as easily accessible to us because of the roadblocks that and the challenges that were in place in the system. That Cuba could not access certain websites. If you went online, for example, you could not access certain websites from Cuba because you were blocked by the United States government. And that, had its difficulties in terms of when you wanted to do research for a project, or you wanted to update certain information that you have that's relevant, because now everything is digitally based, right? So we had to confront those realities. But the opportunity in that is that we learned to improvise and to adapt to our circumstances. The Cubans taught us a lot of that because they had found ways in which we could wisely use the limited internet access we did have. We could download resources maybe from home stateside, and then bring it back to the island and share with our friends from other countries. We could also go to the main libraries in the city, which may have had access to resources that we didn't have. Our medical school also had, its access to specific resources that we needed. But those were some of that's just one example of the challenges that we face. Then we talk about basic, necessities. Those day-to-day challenges of electricity shortages, or water rationing throughout the day or the week, because Cuba has to save its electricity consumption. It also has to make sure that water is spread out throughout the population at different times of the day so that everybody can have a little bit, all because the infrastructure of the country has, aged over the years. Under all these sanctions, there have been so many difficulties in getting parts to repair different buildings and different equipment. And so all of these things then play a role in how your everyday life goes, because you just can't wake up and, have the lights on all day because you want to study. You have to know that, the lights are going to be on at a certain period of time, and you have to maximize the time that you do have to study. You have to know that the water is going to be cut on and cut off. So you have to maximize the time that you decide to take a shower, wash your clothes, do basic things that we had taken for granted from coming from where we were, but that we all had to learn to adapt to as an everyday part of life. And then talk about going to, the market and finding basic supplies and foods that you needed. For many of us, our experiences, whether for myself in Ghana or the US, I could go to any supermarket or any open air market and probably find things with ease if I had the money. But in Cuba, that's not necessarily the case, where you may have the money, but the particular item you're looking for is not on the island because, unfortunately, due to the sanctions, that particular resource hasn't been able to make it to Cuba for whatever reason. So those are some of the challenges. Medicines, when we talked about treating our patients as we were growing in our clinical studies and learning how to manage people's illnesses, there were lots of moments where people would have simple issues, whether it's hypertension that they needed medication for, and unfortunately, that medication is not on the island at that moment because all the backlog from all the challenges that the sanctions placed on Cuba, they haven't been able to get, for example, what we call an angiotensin converting inhibitor medication, enalapril. You can't get enalapril right now because it's just not there. because it is unfortunately a medication that is a U.S. based medication, and for Cuba to get it, they have to go to a third party, and then the third party has difficulties. Cuba has to pay cash. All these different things that play out into all the challenges that we witnessed and we faced on the island.
Thank you very much, Dr. Addrey, for that. We've learned from you, and we appreciate you for that. So coming back to Dr. Joe Amara, you're Sierra Leonean and you have lived here. I believe you've got some experience with our medical facility here in Sierra Leone. So how can you compare the Cuban medical facility with other countries, most especially Sierra Leone?
Thank you very much for that question. Really, like you just said, I have been in the system before, the medical system in Sierra Leone. I first entered into the university around 2009-2010 academic year. That's quite a very long time, around 14 years. So I started my pre-med there at the Koso town, and later pre-med, after pre-med 1, pre-med 2, you go to first year, second year, then we had the Ebola crisis. I was the time I moved over to Cuba. Start all over again. And the difference when it comes to the tutoring, the intensive tutoring, you have your in the Cuban system, the medical system. When I mean personal assistant, not just on the academics, the person looks after your welfare, your well-being as a student. You can basically look up to that person, your mother or your father, your aunt, so you can feel free to discuss whatever issue that you have. If you have academic difficulties, they can easily come up to your aid and assist you to whatever you need. If you have problems, socioeconomic problems, as Dr. Samira already highlighted, a very big issues that have been digested by most of you, they can always be there for you. The teachers there 24/7. There is nothing like teacher is absent. They're there 24/7 for you. And it's not a competitive space, like you're trying to be the best in class. It's not like the space there is to cooperate, to as a group, teamwork. It's very, very much important to work team. As an individual, you can go very fast, but if you go very far, or if you want to go, sorry, a call interrupted video. If you want to go very far, you go as a team. That's how the medical system operates. Most of you who are young people who might venture into the future, you see how much impact it will create working together as a team. The nurses working with the doctors, the laboratory scientists, the social welfare, the cleaners, everybody is affected. There is nothing like that social class, the doctor feeling like I'm above everyone, no. Or the nurse feeling like he or she's above the cleaner. Everybody works with respect. So like everybody feels like they have something to bring to the table. Holistic approach, integral approach, making sure everybody their own lead role, which brings about a very there is intensive. The first day you come, they make sure they give you a test. That test is not for you to it's for you to know like the level. It's like a pre-test to check the IQ level or which class they should group you into, because they tend to understand that people tend to be older, and also those who are fast. People who are slower and take this guy. Then in a class where they need special attention, they give it to them. And for those who are fast learners, they also have their class. So they try to arrange the system where you can feel comfortable. And one unique beauty I will mention is compared to many other countries, don't victimize you. Imagine you going to see the patient is even ready than you. The patient, oh, doctor, you can go ahead and examine me. There's no problem with that. So they can even lie on the hospital bed, ready for you to touch, obviously with their consent, because we seek their medical consent and receive the advice training that general integral medicine. Since the pre-med, we also have a pre-med system. Well, that pre-med is for us to have a background in Spanish, because all our interactions is done in Spanish. You take oral written exams, Spanish. They give you your conference. After the conference, you have workshop. You have with targeted questions. They give you the objectives, the guidelines, the materials. You need to go out and look for, except if you want to do some research program. They give you all the materials. You don't need to take any extra book with you when you come into Cuba. They provide you the uniform. They provide the books. You have almost everything within the school. You have places to play football, basketball, swimming pool in the same school. You have the university extension where they teach you how to dance salsa, because the Cuban culture is rich. You can dance. It's not just about education. Book. Medicine is a social product. If you only know about medicine, then you know nothing, because we humans are psychosocial human beings. That means we need to interact with our environment, with our people. So the culture is rich. Look at the structure of the schools. You have amphitheaters, you have huge classrooms, and you have lots of professors who are determined to make sure that they give the right information. And if any chance, anybody by any chance or let's say misfortune, anyone fails, you have the right to take ordinary exams, extraordinary exams, and also mundial exams. 3 times you'll be taking your exam. So it's very difficult for you to fail. The objective is for you to be trained as a doctor of conscience and science, and to implement that in your communities.
Thank you very much, Dr. Jeremiah. We appreciate you for that, for sharing that. And if you want to ask question, you can indicate by raising your hand so that we see you. All right. We have someone who wants to say something.
Yes, hello, good morning. How are you? I'm Dr. Masala from Texas. I'm an eye doctor. I went to school in Ohio State, in the United States, and I've been practicing medicine for about 17 years now. I work very much private practice, and it's interesting to hear, the difference between, the medicine education in Cuba versus the education that I had here. And I just wanted to touch on just a couple of points that you guys said, about the whole body wellness, and how that was something that in Cuba was very big in terms of how you guys were educated. That's really the way that I kind of approach medicine in terms of my patient care. It's like I try to actually get to know my patients and understand what the real issues are and the real needs are. Because sometimes, they have social needs, or there are other aspects of their lives that are affecting their health versus, just the need for medicine. So I just wanted to touch on that part. And then also, you guys spoke about the schooling and how the schooling was, such that, it wasn't so much about competition as it was about camaraderie, about people helping each other, and the need to, I guess, help the community as a whole. And I think that's also fascinating. In the environments that we work in here, it's more of a competitive environment. Of course, in the end, it makes you stronger.
This is an African student voice. We entertain, educate, and inform. We are Africans. We owe our being to the hills and the valleys, the mountains and the plains, the rivers, the deserts, the trees, the flowers, and the ever-changing season that define the face of our native land. Africa must revert to what it was before it was divided.
Pan-Africanism was the attempt to create a sense of brotherhood and collaboration among African descent, whether they lived inside or outside of Africa. At PASV, we promote MELTS, which is mathematics, engineering, literacy, technology and science, which is what Africa needs to invest in to be great again.
You know, we have this hospital. We have in every province hospitals. Most of the tourists, they also have this thing called medical tourism. Medical tourism, this is a special that receives patients or people coming from different parts of the world. And Cuba is a center of reference when it comes to effective treatment at very low cost compared to other countries. So that has attracted most people coming from the US, Europe, the Latin American continent, the Caribbean, and talking about keloid, there are lots and lots of specialists. One of the hospitals of reference is called Hermanos Jamejeras. That's a Spanish name. That hospital is a multidisciplinary hospital that has almost every specialty grouped in one. So you can do your quick interconsultancy swiftly from one department to the other without wasting any time. So if one was to do any operation, which is surgical, lots and lots of offers, and should try to link up with the medical tourism so that the appropriate operations will be made in place. Thank you.
All right, doctor. So, quick one from our local frequency. Somebody is asking if those operations are free, or you have to pay certain amounts to be able to be operated.
For us doing the scholarship, like myself and most students who have been on the island for quite some time now, it's free for us and also for the citizens, the Cuban citizens. For example, if you have to do a heart transplant, where I work at the Institute of Cardiology, or you have to put a stent, a normal procedure to unblock blocked arteries, or where the blood passes, if you have to do all of that, or to put a mechanical valve in your heart, which cost a fortune, but for the Cuban citizen, it's free of cost. For foreigners coming into the country, asking at a price, it's very much cost effective. You pay, but it's not too much as compared to paying in other countries, which in the future, like I previously said before the question was even asked, it has attracted many people coming from different parts of the world. You can have people coming from other, let's say, top surgical operations like myocardial revascularization. That's, sorry for the iatrogenic term. It's basically a bypass surgery. Bypass surgery, it's one of the top surgeries in the world. Open heart.
As Africans,
a student is asking, say, as an African and a Ghanaian, what are your plans to help the medical facility in Africa and Ghana, most especially?
for the question. In my particular case, it's always been my goal to transition myself from, living in the United States, working here, and going back home and being in both places, essentially part-time, because of different responsibilities, family, and my commitment to African development. Picking up and connecting with some of the same people we studied with in Cuba who are from Ghana, fellow Ghanaians who are already there and have been working in the system And through their expertise, because they're on the ground there and they know what the needs are, knowing where I can help supplement what needs to be done, collaboration in projects, especially for our rural areas. That continues to be a serious problem in Ghana, even though there's a national health system. When I was in medical school, one of my summers I spent in Ghana, in my grandmother's village, trying to implement what I had learned in Cuba, which was a Brigada Estudiantil de Salud, which is a student health brigade project. And for me, it was studying the use of herbal medicine to treat basic ailments within that village community. And I learned a lot about the lack of access that my people had to basic resources and basic procedures in health, right? So in just doing that project, I was able to understand where the gaps are in the health system, but also in talking to my colleagues from Ghana, I was able to understand where the gaps are and where we need to do more work to strengthen the system. Most of the people, they may have the ability to go to a regional hospital to get attention, to get examined for whatever problems they're presenting, but the issue then becomes, even if they're written a prescription, they don't have the money to buy the basic medicines that they need to take care of that. And so there's still this issue of making sure that our Ghanaian health system understands that there is a need for making medicines more accessible to people, making these clinics also more accessible, that people don't have to trek to get to them, and that we have the ability to incorporate some of the things we learned in Cuba, like going to people's homes rather than waiting for them to come to you in the hospital when they're almost dying. Those are some of the things on a basic level, and also teaching the youth and the community members to be active agents in their own health. That's something we learned in Cuba, and I know my colleagues and I wanted to translate that to our Ghanaian community, because, you know, back home, everybody sees the doctor and the nurse as almost like a god, but it's our role as Cuban trained professionals to teach people that each and every one of us have a role to play in making sure we are healthy, and bringing the community together to learn basic elements of what it takes to be healthy, so that we can take charge of the situation ourselves and not just rely on a few people who went to medical school to solve our problems. So I hope to be able to implement those plans after I finish residency. So that is at least going to be another 5 years of working and toiling here in the United States before getting off the ground to be able to go back and forth and work with my colleagues in Ghana. So I hope that answers the question.
And this is Pan-African Student Voice 030342614.
I was born in Kono. Kono, that's one of the districts in Sierra Leone. As you all know, as Sierra Leoneans, we have Kono and the Eastern region, a place called Yengema. At one of the hospitals there, that's called National Diamond Mining Hospital. That was during the war. You all know how the war had a serious toll on us. It was devastating. It claimed so many lives. You get to see people who suffer diseases which could have been prevented. But because we don't have the primary health care system that is accessible, that is universal, that does not look at your social status, whether you're rich or poor, it's difficult for most of these problems to amend. If I was not going to study medicine and think of going back to my country, then there would have been no need to start. You can go to, there are countries where they can pay you a lot of money. I say this again, money is not everything, but looking at the long run, the impact you'll make with what you have earned in the lives of people, that goes a long way. We need to create that impact, and we have to do it like being there. Essential. We have to be there to make that change. We need to see ourselves as elements of change. we don't need to wait for donors to come and start making that change. We ourselves need. I know the brain drain situation has been taking a toll on all of us because everybody wants a better life, everybody wants a better service. So that's why most people are going away because of lack of the conditions, the ideal conditions, the adequate settings for them to function. It's not easy, but when you finally achieve what you are going to achieve outside there, please don't forget people, your home, where you need to at least display some of these things that can be beneficial to humanity. Because of what essence will be to live or graduate as a doctor and stay all my whole life away from my people. It's a waste of time and resources. So I'd rather not be a doctor, sitting down in other places without coming back home. I'd rather not be, because home has always been the place where they had. We need education in health education. So Cuba was the only single country around 2014 that dispatched the highest number of medical team and personnel, nurses, doctors to come not just to Sierra Leone, West Africa, Liberia, Guinea, to help mitigate the endemic situation in the West African region. All embassies were closed. In Cuba, we have a cat lab. A cat lab is a place where they can attend to you very fast and on block. That place that was already blocked. It's like you're in a kitchen. You're washing. Then the pipe or tube where water goes through is blocked. If you don't open it, there's no way water can pass freely. So that's what happens to our heart when it gets blocked. And we as cardiologists or future cardiologists, we have 10 minutes to diagnose that if the person comes to the hospital on time. If not, they are doomed. We don't have a cath lab in Sierra Leone. That's one of the challenges. And heart attack does not respect your social status. You can be the most prominent politician. You can also be a very poor person. But it's for everyone. So if we don't try to invest in things that matters, we will continue to lose people. The mortality rate will be very, very high. I admire Cuba a lot because where I studied penal, at one point in time, we had 0 infant mortality rate. 0. No child was supposed to die unnecessarily. Not from dehydration, neither from infectious diseases, not from malnutrition and anemia. And these are all causes of death in Sierra Leone, in my country. Things that we can prevent, yet still people are dying.
Thank you very much, Dr. Joe. So we have another question from a medical student at the College of Medicine. She's asking that as a cardiologist, you know how you left Sierra Leone? So if should in case you come back to Sierra Leone and you don't meet equipment, you'll be able to take you through your course, what would you do? Are there any plans put in place for that?
Thank you for the question. These are some of the things that I've evaluated way before, way before, because I knew what I was going to do, which path I'm leading, which path I'm going. These are discussions which I've had with myself and also people, because it's really one of the top specialties addressing killer diseases in the world. And there are many emergencies, like I already said, difficult situations where we have to take rapid decisions to save lives. We don't have an institute. I know that we don't have all the resources, but there are some things in life that we must try to consider. Life, it's nice to take risk. If no one is going to study, if no one do it, then just do it. Especially if it's your passion. You need the basic tools. What are some of these basic tools? You have your ECG is like electrocardiograph. It's It's on a piece of paper which registers your heart rhythm. So that's one of the things. The other thing that we need for basic setting is echo machine, echocardiogram. It takes pictures of your heart. No, I know there might be people here who like to take selfies or normal photos, but the machine takes pictures of your heart. See how beautiful it is. It takes pictures in moving motion. It can diagnose lots of diseases. It can also give prognosis of future outcomes of this disease and how you manage the patient. It can be used to evaluate, diagnose, and measure. So you also need Holter. Holter is also a very cute machine, very small. It has some leads which you can put on the chest. You can fix them appropriately. Then the patient can, let's say, pass 24 hours. It depends on how long you program it, 24 hours. And it registers any abnormal reading that you might be looking for also.
Good afternoon. This is Pan Africa Student Voice Radio 89.9 FM broadcasting live in Freetown, Sierra Leone.
This is Pan African Student Voice. We entertain, educate, and inform. We are Africans. We owe our being to the hills and the valleys, the mountains and the plains, the rivers, the deserts, the trees, the flowers, and the ever-changing season that define the face of our native land. Africa must revert to what it was before it was divided.
Pan-Africanism was the attempt to create a sense of brotherhood and collaboration among African descent, whether they lived inside or outside of Africa. At PASV, we promote MELTS, which is mathematics, engineering, literacy, technology and science, which is what Africa needs to invest in to be great again.
Like I was saying, I am a medical student here at Sierra Leone, studying at the College of Medicine and Allied Health Science. Considering the fact that we've been constrained with a lot of experimental apparatus that has to help us in the career pathway, I think this is a great opportunity given to us, knowing that students are catered for elsewhere that is a little bit better. Okay, now my question is, if there is somebody that would like to apply for a scholarship at Cuba to further their studies, I would like to know what's the criteria that you are basically looking for, so that the pupils will be able to work up to that criteria. As well, if there is a quota for students to be granted a scholarship, I would also want to know what is a quota of applicants that is required, especially per school. Because some of us as medical students, we see this as a great opportunity, and we wouldn't mind to continue the course over there. So it's a concern and it's a passionate one. That's it, man.
So in the case of U.S. students, we say we need people who are 18 to 25 years old, who have taken college level sciences, specifically biology, general chemistry, organic chemistry, physics, and they should have also passed with at least an average of a B or better, and they should have no criminal background, and they should be a U.S. citizen. That's the basic criteria for U.S. citizens. But aside from that, our organization that is administering the scholarship is looking for students who are who have a commitment to the communities that they come from, so they can represent those communities and come back to the United States and work in those communities, which are mainly poor communities of African Americans, Latino, Asian communities that don't have enough access to health. So those are the sort of students that we try to recruit. But in the case of Sierra Leone, there should be a different set that Dr. Joe can tell you more about.
That's good. So is there any aspect of the quota, like I mentioned earlier on? I think I'm convinced with your answer, but I would like to know the quota that probably you cater for, and what are the intervals? Maybe you do it twice a year or once.
So every country has a different agreement with the Cuban government. In the case of the U.S., there's a 10 student quota right now. As since maybe I think 2018, it's been 10 scholarships per year. But before that, it was 30, 40. So it's a different quota for each country.
Knowing that the person who asked the question is also a Sierra Leonean, but he had wanted to know about the American too. So we're glad about that, because it's a symposium for interaction. That's why it's called Global Interaction. So feel free to ask anything pertaining to the topic of discussion. So to go direct to the answers. First, the scholarships are advertised by the Ministry of Education in Sierra Leone.
Okay.
Through the Cuban embassy.
Yeah.
They pass on the information to years, and later reaches to the Ministry of Education in Sierra Leone. So they are the ones who advertise the scholarship. When they advertise the scholarship, they put area that Dr. Samira had already the age 18 to 25. Also your police clearance form, because the police clearance form helps to know if the person does not have any criminal record. They don't want anybody that might go and cause problem, because we are all ambassadors for our country. So acting as an ambassador for your country, there must be some level of seriousness and integrity. So you need to have a recommendation letter. People in society also who think maybe from your past, or an engineer, or let's say a civil servant worker who might recommend that this person is serious, what plan, has that passion and desire. You have to do your medical test, HR, technology, PDRL, syphilis, all these diseases. Yeah, you need to do them. Pregnancy for ladies, you need to do your pregnancy test, because you can't go there. This is very serious, because there are times when people finish their studies, they forget about the mission. Why the Latin American School of Andrew Castro, who is the ex-commander-in-chief, the late president of Cuba, according to his vision, he wanted to train doctors and go back and serve these low-income resource countries. So
I think that's
if you want to serve your country, then that is more reason for you to be there. But you have to also have good grades, C5, biology, chemistry, physics, math. Because the last time I was in Sierra Leone, this same year, I was at the embassy and I saw the criteria. Nothing changed. It's still the same. So you need to have that passion, that desire to learn and come back and give back to society. As you observe, Dr. Samira is from the United States, also has the Ghanaian background. And looking at America, the tuition fee alone for the whole medical system can even go up to a lot of money, $1 million. So people are having debt. Because of the debt, they can't go back to the whole community and serve. They want to offer or pay for their services. So that's why people who are trained, for example, in the United States and have these debts, they don't go back to this low income resource. So Cuba sends scholarship to you so that people who come from these targeted areas can go back and deliver to those areas. So that's the point. You coming from Sierra Leone, opting for such scholarship must be determined to return back and serve. Because if nobody wants to serve people from the most remote areas, then what's the need of going, of trying a medical doctor? Is it for the money? Is it for the thing, the prestige? Or well, it's to help people. So that's a very part of the vision. The rest, you can receive the full scholarship amongst the chaos and challenge but you will fit in. People do fit in. We have been able to navigate and manage it, and now we're here. Any worked for that scholarship will not be disappointed.
Right. Thank you very much, Doctor, for that. So we are going to cutting down for today's edition of Global Interaction, and we encourage everyone who wants to donate to the Pan African Student Voice to reach us at admin@psvmedia.com, or you can check on our Facebook page, Pan African Student Voice Radio, and you'll be able to get us. We want to appreciate our guests, Dr. Samira Addrey and Dr. Joe Amara, for this teaching, and we really do appreciate you with a grateful heart. We say we've learned a lot as Sierra Leoneans, as Africans, and people all around the globe. We want to appreciate you for the time you've given to talk to us. And we want to appreciate all our participants all around the globe for joining in this Zoom meeting. And for those that are listening to us on our local frequency, Pan African Student Voice 89.9 FM, we appreciate you all for being with us for this educative session, knowing about Cuban scholarship and its global impact all around the world. We want to appreciate the JTFL Memorial French Friendship School for being part of this discussion today. We thank the College of Medicine and Allied Health Sciences for sending their students to be part of this discussion. And we appreciate the staffs and of Pan African Student Voice and the staffs of the JTFL school. Let's have a word of thanks from the chairman of the JTFL Memorial French Friendship School,
Dr. Samira and Dr. Koroma, and all the other organizers of this program. My name is Evan Thomas, chairman of the board of governors of the school. On behalf of the school, the principal is here, members of staff are here, and the pupils from the majority of the audience here this evening. We want to thank you for your time. We want to thank Professor Prince Reful as well for facilitating this program. He intimated us that it would be the start of a relationship. You have heard the inquisitive questions from the students, which is very encouraging. And I would plead with you to make sure that this is just the beginning of the relationship, and that you would keep in touch with the school, and through Dr. Reful, the pupils will be able to contact you and interact with you, so that they will be able to have more access to medical education in Cuba. Thank you very much.
This edition of Global Interaction, which I hosted Marion on Kargbo, through the opportunity given to me by Professor Marcela Reful, who is the CEO of the African Student Voice Radio. I want to appreciate our participants once more for giving us a listen here to be able to have this educative discussion with Dr. Joe Amara and Dr. Addrey from the Cuban Educational and Medical
the hub of science, technology, engineering, and mathematics.
Africans, we entertain, educate, and inform.
In this world, there is a continent called Africa. In Africa, there is a country called Sierra. In Sierra Leone, there is a city called Freetown. In Freetown, there is a radio station called